Coming to you straight from the Rio Grande and beyond. Broadcasting to the four corners of the globe. So grab your seat, your coffee, or your sundowner.
Okay, everybody, here we go.
On point, as always. This is Gloves Off. Gloves Off.
Wherever you call home, we are there. In favorite places. Large spaces. For many homes, we have coverage that fits the way you live. And with our home systems protection, you can cover major home appliances and more. We cover more type of homes than ever. Get the coverage you and your family deserves. For a free no obligation quote, visit us online or simply give us a call.
We're back at you in Gloves Off, and today got a great guest with a great topic about Laredo. It's citizens in Laredo, Laredoans in general, deals with diabetes. It's PAD specialists, and the owner and operator and the specialist in there is Adrian Zapata. And here we are. How are we doing today? You doing good?
Well, we're doing well. Thank you for having me. I was looking at your YouTube, man. You're growing in reach out there. I think you have almost 10,000 subscribers out there. So, the info that we get out there, we know it's getting to the people. So we appreciate that, and we appreciate your activity in the field and just getting consistent messages out to Laredo, because we know that that's what you're about. And I know that healthcare is something that's very near to your heart, as your father was a physician as well. And I appreciate you giving me the opportunity to talk about a little bit of healthcare in Laredo here and what we're looking at and kind of some of the challenges. And I have a few things that I wanted to share with you guys. Again, my name is Adrian Zapata. I'm the business development executive for PAD specialist here in Laredo. I'm also have an health insurance license that I've maintained for 12 years. So I understand how the insurance works. So I appreciate you having me today.
I want to thank you with what you do. Diabetes is a subject that touches all Laredoans, family member, some are going through it. And it's something that there's a difference between, as I've learned, there's diabetes that's youth diabetes, like child diabetes, and then there's diabetes that one can grow into as age comes through, right? So I've always heard the numbers that were very high in diabetes here in Laredo, and there's a couple of questions that I have. Is this genetically? Is this infused like by water, what we're drinking? Is it our diet, or what are the causes of this, or everything together?
Those are good questions. And the simple answer is, about 20% of our adult population is has diabetes. Now,
Is that nationwide or here?
No, that's in Webb County, actually. In and if Can I share my screen?
Yeah, you can if you can.
So I'm pulling up. This is the city of Laredo's health assessment that was done in 2023. This was I pulled this off of the city of Laredo's website. So it's straight from their website. And if you go to the cityoflaredo.com, you click on departments, you go to the health department, and then from there you look for on the side community needs assessments. So this is information we all have access to. There's two things on there. There's a Laredo healthcare assessment that was done. This kind of just tells us everything that's been going on in what's happening in Laredo, and then the community health needs assessment. So everything that we need here. So just kind of getting into it, looking at the health assessment here, and really want to get into the diabetes part here. And as you can see here, diabetes is the most prevalent healthcare condition in Webb County, affecting 23% of the population. So this is straight from from a medical study that was done here. And diabetes affects everything. Diabetes is what I say, it's the gateway to all the other conditions that we have, whether that's cardiac disease and um, other diseases there. But a little further down here, you can see that Webb also has the highest rate of amputations uh, among patients with diabetes at so highest rate of amputations. So Webb County number one in amputations, had a high rate, only below Hidalgo County, which is the valley, and Nueces County, which is the Corpus area, and Cameron. But we're also the average cost of an amputation in Webb County is 214,000 compared to the state average of 123,000. Isn't that nuts?
That gives me a kind of nefarious question I'm going to ask. Are these amputations a malpractice type of amputation, or is it a type of a amputation like they're led into an amputation? Is it a medical, not
I'm glad that you asked that. Yeah.
or
So,
is it
yeah.
basically, now when you see the prices there, it's like kind of like, well, guess what? Here's money to be made.
There's a little bit of everything in there, right? And there's a little bit of everything cooked up in there. But the data says that Laredo Webb County, we're in a medically underserved area, right?
Right.
So medically underserved area, you're not naturally we're gonna have less places to go, less specialists to see. So previous to PAD, so previous to 2021 and PAD specialists being open, there was not anybody here in Laredo that was specializing in the diagnosis and treatment of peripheral arterial disease. So PAD is going to be something that's going to lead to amputations because it's going to
Correct.
be what PAD is a blockage of the it's a buildup of plaque in the arteries in the legs, so it prevents blood flow down to the lower extremities. So if somebody got a cut in their foot, if they don't have blood flowing there, then now they're going to get an infection. And what we do at pads is we clear out those arteries so that the blood flow can happen. But pre 2021, let's say that somebody went to a hospital, and if they had no other option, if they didn't see any blood flowing from, let's say, the ankle down, um, the foot was turning black or the toe was turning black. Well, a lot of what the orthopods would do, a lot of some of these surgeons, it's easier for them to cut than to go in and fix the arteries. So kind of I hope that answers your question there a little bit. And then sometimes, unfortunately, sometimes people say, well, the arteries in the upper half of your lower leg are they're about 3 to 4 centimeters wide compared to the ankle, which is about 1 to 2 centimeters wide. So the recovery is going to be more difficult. Well, the surgery is going to be more difficult cutting an ankle because now you have the arteries are a little bit more difficult to to connect back together, get going. So it's easier to cut higher, do a below the knee or above the knee amputation, and then that's how you ended up with, a higher um, amputation rate. and then higher amputation cost as well, which we'll go
Right.
back to that one. Yeah, so that's a little bit of both, a little bit of not enough specialties here, and then the specialties that were here, it's just easier to do a cut somewhere, which is why it was so important that we opened up PAD specialists to be able to open those arteries up to prevent amputations.
Absolutely. Now, back to a step. Let's going back a step.
Yeah.
Let's and the plaque you say about the plaque buildup. Is the plaque buildup because of diet, or is it minerals, or is it because of genetics? What
Yeah.
is what is the basic
Sorry, I didn't
outcome of it?
answer. I meant to answer that piece of your question as well. Um, we're the diabetes that we have in the area, and then the all the other conditions that we have is a combination of things. One, genetics, right? We're more susceptible as Hispanics to heart disease and to diabetes, etc. But we're increasing that. We're speeding that process up with the foods that we eat. So the tacos, the a lot of the greasy foods that we have, a lot of the red meat that we eat. Um, we love it, and I love it. I mean, I love my fajitas, I love my taco palenque, but it's portion control, and then it's also the types of foods that we're eating that is causing the plaque buildup in the arteries, which causes heart attacks, and then in this case, what we're talking about amputations as well.
Absolutely. Is this prevalent? If you said that about Hispanics or throughout or Latinos throughout, does this resonate throughout the whole United States on the Hispanic population? How about Mexico and some of the other Latin countries? Is it the same or
You
not?
know, I'll tell you what, that South Texas in general is on another level for diabetes, for uh, heart conditions, and then you can look at the northern Mexico, so your border town areas, also facing the same dilemma on the Mexican side. I'd have to get some more data for you for some of the other, South American and Central American countries, Latin American countries, but I'm almost positive that, you're seeing the worst here in South Texas and the border area. And again, it goes back to our traditional, um, our food, the food that we eat here, a little bit greasy.
Right. Because if you look about, I'm going to take it on the in gastronomically wise. If we're talking about greasy foods, then we should see the kind of the same prevalence in amputees and diabetes in the areas around New Orleans and issues like that. And
And you
you know
see
what
it
I'm
there. Yeah.
what I'm
Yep.
saying? So that's something that we have to look into. And
And
the
you
reason
see
I
it there in New Orleans as well. Like you see the African American population is step in step with unfortunately with the Hispanics in these chronic conditions like your diabetes, and then of course heart disease, at risk for stroke. So they're also high prevalence, but for some reason here on the border, we're a good 7 to 10% higher prevalence than in those areas in the New Orleans deep South areas.
correct, correct. So basically, number one is rechange the diet intake, and like you said, the portions. Not really the diet, because that's going to be very hard to change, but the intake. And people should exercise. I don't care whether it's bike riding, running, walking, boxing, martial arts, whatever you want to do. You go out there and start exercising. I'm a very much prevalent into that. And the older we get, and the less we can maintain strength, but our muscle density is going to lower ourselves. And we have a lot of individuals that never did anything for the first 50 years of their life, and all of a sudden start running, and all of a sudden, boom, bingo, there's a heart attack. You say, well, but the person was a runner. Yeah, but he never exercised for 40 years or 50 years, and all of a sudden wants to jump up and start doing something like this, and all of a sudden here, bingo, he has a heart attack. So if you've exercised, if you've been one that's always been playing sports, continue it. That's what I say. Continue. Yeah. Don't just stop abruptly.
Even if you're just taking a walk around the park, right? But
Right.
even going further than that, I wanted to cover something else, is that if we look here, about 1/3 of Webb County's population, so 32%, is uninsured. So if somebody doesn't have health insurance, they're never going to go to the doctor. If they don't go to the doctor, they're never going to get the education they need on what their body's telling them, lab work, blood work, or just overall health education from a primary care physician. So if you look at this generationally, you see that, Laredo has right now a high amount of childhood obesity.
Of course.
Childhood obesity is terrible because that's we're seeing people develop type 2 diabetes early, 13, 14, 15 years old, but they're not getting the education they need because they don't have health insurance. They're not getting to the doctor.
You mentioned something there about childhood obesity. Our younger generation is what I've seen, because I've seen it in a different format and through teaching and so on and so forth. I've seen it. I'm going to change the term weak to fragile. Okay. And talking about weak like being strong. I'm talking about weak like in discipline and so on and so forth. Okay. So for people out there, not to think of it as a strength mechanism or that, but I've seen our kids become weaker, not only physically, but mentally over the last, I guess, over the last 15 years, 15 years, it's just accelerated dramatically. I mean, the kids, spiritually, conditionally wise, they're very weak. And especially our males, they're very, very weak. And the ones that want to catch up, you can't, how can I say, you don't have the physical ability mentally to grasp that. And I think that's where we're at. I mean, you said it there, the obesity, there's no discipline. That's a type of weakness that I have. And you also said something that's very, very interesting, and you used the word generationally. Well, you have 2, 3 generations that have that type of growing. Of course, it starts weakening as you produce ourselves. You have a family member that doesn't have discipline. The parents don't discipline them. They grow up and they don't discipline their kids, or they don't push their kids. They could nonchalantly, they could care less. Well, all of a sudden those patterns continue and grow out. Now we have the problem that we have, and I see it.
Now check this out. This kind of goes to just what you're talking about, is social detriments of health, right? We see that poor health or fair health, Webb County, 34% compared to 15% top US performers, 21% for Texas. So poor physical health days, higher here than anywhere else. So you're right. This is it's a quality of life issue. There's then that goes back to even further a healthcare shortage that we have, right? And it says here we're lacking mental health providers as well. So I'm not saying that the kids need to go to the mental health place, but this kind of goes into what you're talking about, is that are are people weak minded, right? And are they getting up in the morning to go, are they making that push to go and take that walk, get that exercise that they need, right? And I don't think enough people are. Um, I don't think enough people are right now.
Habits, there's also sorts of habits, and habits can become vices as well.
Mm.
And poor habits, poor physical habits or training habits, they'll eventually multiply into vices. Um, that tolerance and people that let's take about I want to check out diabetes right now. The next question between alcoholism and diabetes as well. And what I'm getting to is that tolerance. You get a how can I put it? You say, well, guess what? I'm not going to work out today. That's already one day that you didn't work out, and you're the one that worked out 5 days a week. The next day you go work out, you feel a little bit tired. Then the next day you come out and say, you know what? I'm not going to work out today. So you already missed 2 out of the 5. The following week you'll add another day. By the time you know it, there's already 5 days, and then it's a month that you don't work out, 2, 3, 4, 5, and it continues going in there. The same thing happens. You say, I'm gonna have a beer. You have one beer. The next day you say, gee, you know what? I'm gonna have a second one. And you say, you know what? And not only am I gonna have two, I'm gonna have that little shot of whiskey over here on the side. By the time you know it, you're drinking half a bottle. So that tolerance starts building up, and that those tolerance become vices, and habits become that. So you want to train your good habits, and you want to push yourself to be better. And again, like you said, the social status where you're at emotionally. If you go into a family that the family's that way already, it's very hard for that one person to get out of there. A lot harder than it is if the family's active and has no vices whatsoever. And that's what I think is the problem that we have here. It's a social problem that we have here in the community. And it's how can I say it? I heard this the other day. You will never excel when the people around you are before your performance level. So you're going to drop your performance level to meet theirs.
Yeah, it's like playing down to your competition, right?
Exactly.
Right. You know, you're on it right now because I just did a search in this in the health assessment here, and look, it says the top 5 mental health and substance use diagnosis in for Texas, you know, alcohol related disorders. So that's another thing that's, you know, affecting us, right? Alcohol. So you're nailing everything here because it all goes hand in hand. This is stuff that you know, somebody's drinking too much, you know, they're not going to be as physically active. If they're not physically active, you know, their health is going to start uh, being a detriment to them.
Absolutely. Absolutely. Like I said, I'm not here condoning for people not to go out there and drink. If you want to have a wine or a beer, do so. Do it moderately. Do it responsibly. But when I see this, especially with us here. Uh, monthly classes here or tuition is $200 a month. All right. You got guys out there that on a Thursday night and happy hour will spend 500, spend 200 on a weekend. They'll spend 1,000. And then they come around and say, well, I don't have money to go train. Really? Well, quit drinking. Understand what I'm saying? So people need to moderate themselves. And especially if you're a young man or a young woman that has a job that's not paying that much and you're spending $200-300 Friday and Saturday. Understand what I'm saying? So eventually your vices are going to bring you down.
And that leads to, you know, all these you know, just the average age coming down nationally, uh, and then I imagine we'll start seeing that locally as well. That, you know, the average age of someone living is coming down as well. But really, you know, what gets us here in Laredo is this is the heart disease, the and that's all caused because diabetes, and again, diabetes because of the alcohol, because of the diet and all those other things as well. So, you know, this was kind of something I had on amputations here, and this kind of goes back to what we were talking about earlier on. 60% of patients who have had a limb amputated, due to peripheral arterial disease, they never even had an attempt to get their artery revascularized. And we know that 95% of major amputations are that are due to the vascular issues. They can be prevented with a revascularization. So it's important to that we, as Laredoans, it's important that we continue to get educated, to bring people back and grow our medical community, and we get better, but we also get educated in making sure we're getting our 60 minutes a day of of physical activity, making sure that we're not putting in, 5,000 calories a day in, especially liquid calories in food or in consumption. Let's keep that under 2,000 a day, under 1,500 calories a day, and let's curb all those liquid calories, which are the worst calories.
Absolutely. You know, back in the 80s and 90s, when bodybuilding and weightlifting started to grow. It's always been around, but that's when you really saw a growth in a lot of the schools and everything. A lot of people wanted to get big. So they thought that by taking a huge calorie intake, when you're talking about 2000, keep it below 2000, they were pumping in with aminos and proteins and stuff like that, 3,000, 4,000 per day. I mean, these people were getting huge. All of a sudden, and it's a hard listen. Bodybuilding to me is one of the hardest um, disciplines, sporting disciplines that you can take, because mentally you want to kind of not, I wouldn't say malnourished because that's a bad word, but you won't eat as much. You're breaking yourself from eating that much to define yourself muscularly for you to perform, right? And a lot of individuals got into these high intakes, and then all of a sudden they abruptly stopped and they continued with the intake. And I think that's another issue why we had a lot like this jump up. You start seeing again with certain sports. They want bigger people, especially in football, bigger athletes. Hey, you have to put more protein in there. And all of a sudden this kid is 13, 14 years old, getting bigger by the day. And all of a sudden he gets out of high school, doesn't play football anymore, and doesn't train anymore, and continues. And all of a sudden, you have this individual that is pumping down the same amount as if he was training. So, again, nourishment has to be controlled in such a way that if you're training as an athlete and stop, your nourishment also has to go down. And a lot of people aren't doing that. So, I think that's another problem that we have.
100% correct there. 100% correct. And so there's all sorts of stuff that we need to attack. I brought something else up on the screen here for you to check out. Healthcare provider capacity. It shows here we are short 20 primary care physicians in Laredo. That's a significant amount that we're short. So we're short 20 primary care physicians. So we need to do better about bringing our talent home and developing the programs here. That way we can, close this gap here. So just a lot of things that we can work on.
That's interesting what you said that, because I remember my father mentioning that we needed a lot of things here way back when, since the 90s and early 2000s, and it has never changed. I think we have some great physicians here. I think we have some tremendous doctors that we have here, and but I think we have to grow in that a little bit more in everything for us to catch up, because we will be in a crisis, and those are the crises that we need. Those are the crises that we're going to be up with. Mental health is an issue, and I saw that during 2020, during the pandemic. I saw a lot of people suffering through through that. And the only two outcomes that I could get was failure from Laredo, which I was sending a lot of individuals towards because they couldn't take losing their businesses and so on and so forth. So, a lot of individuals were sent that route. And those are the type of services that we need. But again, like I said, this is a I don't know if it's a self-induced crisis or is it a crisis that we're right now finding out that we have. And I think that's what I want to take it that route.
Yeah, I think it's a little bit of both there. So we it kind of goes back to what you said about diabetes and self-induced, and that's us doing it to ourselves, right? With our diet. And I guess, we can say it's self-induced. A lot of these things, like the healthcare shortage. I mean, it's not like it's a friendly business city, right? It's not like it makes we make it easy for people to operate here. So we need to start with, getting better with permitting at the city level. We need to make sure that we're more welcoming to new businesses. That way we can have these gyms open, we can have these nutritional spots open, we can have more physicians open practice here. And then we need to just encourage people to get an education. Uh, we continue to do that, and I think that maybe in a generation we can solve this problem. But this isn't a problem that we're solving overnight. But this is something that we need to start looking at and solving now, because as you saw, diabetes leads to a lot of stuff. I'm just in one section trying to help the people reduce the amputation rate. But there's also people dying of heart attacks, also people having strokes, also people having dementia. Dementia, Alzheimer's, Laredo ranks in the top 10 in the country with prevalence of that as well. I mean, this is ridiculous now, right? We got to get better.
That's why I say, is there something in the water?
I mean, there's a lot of stuff in the water. We
You know
gotta
what I'm saying?
we gotta
Is there water that we're, because there's, people might say parasites and so on and so forth. Yeah, that can be clean, but how about the minerals and the chemicals that go in there and we use them in our food left and right, and we use them and continuously for the longest time. Now, dementia, I read somewhere that dementia had something to do with huge sugar intake, and then some other studies that were not. So I'm like, so I mean, we have that, but again, is it something that is genetic, or is it something that we ourselves are doing to ourselves?
Well, we know that we're more susceptible for genetics. So now the second piece of that is, are we doing it to ourselves? And yeah, we are. When we're eating, three piratas, two piratas instead of just that one, or when we're loading up on greasy foods, we're staying away from fruits and vegetables. We need to fix that. We need to, because it is self-induced, and we're making it worse with our genetics there.
It's like I said, it's habits. Start building good habits.
And we got to be a friendly city, right? Friendly, friendly to the business community. Medically, there's it gets so political as well, right? You have some insurances that don't allow a patient to go to one hospital or the other. Like a few years ago, there was this insurance, Prominence Insurance. They came in the market pretty strong. A lot of people got on the Prominence, and then, they could see any provider they wanted. And then last year, all of a sudden, they pull the rug, and now those patients can't go to Laredo Medical Center anymore. They can only go to Doctor's Hospital. So now you're limiting places that these patients can go. So I'm hoping that the administration now, at the White House, they can fix a lot of these uh, insurance issues that are going on, because I think this all stems back to the implementation of the Affordable Care Act back in 2010. I think we need to, rewrite the way healthcare is done.
No, you're correct. I mean, a lot of people, um, that those issues that are going on there has to be rewritten. The one thing came out of good about this administration is they're going to lower the prices of pharmaceuticals throughout, which I think is a blessing in comparison because we're being taken advantage of, or a lot of people are taken advantage of left and right, and while other countries are paying $5-10 on a medicine, we're paying 200, 350, $500 on the same medicine. So we have to understand that those things exist, and we have to stop it. But it's a huge overhaul. You mentioned about being small business friendly here in Laredo. I think we need that. I think the chamber needs to step up. I think the city of Laredo needs to understand and that this is happening. I think everybody has to come down to basics and say, you know what, we're missing the point here. And especially in the city of Laredo, what you said about permits and such, the timely manner, and not only that, have good customer care. And there's, like I said, habits. Everything's habitual. You get into this format of habit, and you think it's the actual thing to do. No, it's not. There's other ways. And we ourselves have to be the ones, like you said right there, we're the ones have to look at ourselves instead of taking 2 piratas or 3 piratas down in a sitting. You ourselves have to look in the mirror and say, you know what, I'm going to have one. Or guess what, I'm not going to eat that. I'm not going to have that at night. I'm not, you know what I'm saying? Start looking at yourself first. And it'll start with us.
Yeah.
And once it starts resonating, those in charge would start, but they also themselves have to look at themselves and say, look, we've been doing wrong at this particular time. Let's start growing. And it shouldn't be that way, but it is. And I think now now is the time that Laredo has to look at itself in the mirror and say, where do we want to go? Because we're losing a lot of businesses to other towns. Like you said it right there. Do you think a physician wants to come down here and starts looking for a place to open up his clinic, and then they tell him, well, you need this on the building permit, no, you need that on the building permit, this on this contractor, and this and so something that was supposed to take 6 months is now a year and a half into the making, and then by the time you got it, those dreams are already gone. Don't you think those people talk?
100%. That's why we gotta get better about this. That's why we're pounding that. We're pounding that. We really do need to get better at this permitting thing to just make sure business flows. 'Cause we know that when business flows, the community kind of takes care of itself.
Yeah, absolutely. And that's why McAllen has been, and people say, oh, McAllen, it's a valley. There's so many cities down there. No, talking about McAllen. McAllen was the one that actually stepped up over all the rest of them.
Right.
And McAllen is the one that's making the whole valley grow up. That's my opinion. I don't want to insult anybody else over there, but I've seen McAllen at shows as early as 2003, 2004, 2005, promoting McAllen to businesses out around the United States. I mean, they were in trade shows doing that. And I've never seen Laredo anywhere.
Yeah, I do see some improvement the last few weeks here, since the beginning of 2025, and us getting out and being a little bit better about promoting ourselves. But you're right about McAllen. I think they started the trend, and then Brownsville, they picked up there. And they were dealing with some of the same issues as us health wise, but now they're attracting physicians at a faster rate than we are. So we just gotta figure out what's gonna be our niche to be able to close the gap there.
You know, I've sat many students, and I always tell people this: it's not your net worth, it's your network.
Yeah, there you go.
And he called me up, and he had married a young lady that her father, I mean, they married back in the 90s, right? And so their father did a lot of prostheses, They're one of the leading companies doing prostheses for amputees in the youth, and they wanted to bring it here to have the company here, but they needed a warehouse that had a railroad because that's where they ship everything off next to it. And so we're looking for places here. And I remember talking to them and they were going to bring in uh, some of the workers from California, and they were going to transplant them here. People were moving. And they were looking here, they were looking at McAllen, and they were looking in Fort Worth. And because they were from Fort Worth. So eventually they moved to Fort Worth, but they wanted to be here. And I got them some people to sell them some houses. The price, they wouldn't bring down the prices. They wouldn't bring down this, they wouldn't do that. Everything started off, and they're like, I mean, these people are going to buy 15 houses. You know what I'm saying? 15 houses is 15 houses. The place over here, that besides bringing in jobs, I think there were going to be like 50 people working in this company, 60 people working. This was going to be a manufacturing company. Anyway, so eventually the Valley was giving them a great deal. And then later on, they moved straight to Fort Worth, on the other side of Fort Worth. So again, it's how we are treating those that want to come in here, and we have to start looking for the better. And I think building permits is one. I think people are being discouraged when they go in there and try to talk to the planning and zoning and the building and all that, and they just get discouraged and leave. You know.
I hope we get better than that, and we'll get better everywhere then, and education wise as well. You know, again, I appreciate you allowing me to come on here and talk about health, and I think there's so many things we could talk about in health. You know, we uncovered a lot of stuff already: health insurance, amputations, childhood obesity, you know, mental health issues, you know, not the lack of physical activity for some people, and then you know, we boiled it down to, you know, we need to get better as a city, and then the city administration needs to do better about allowing businesses to thrive in order for this stuff to get better.
Absolutely. Now I want to thank you for what you're doing. And this is great education, folks. If you're out there listening to this, watching this, click like, share, have any questions, because this affects everybody, especially here in Laredo. And their diabetes affects somebody that we know, whether it's a friend, family member, or ourselves. And so click like and share it. And once again, Adrian, I want to thank you for coming on. Anything you want to say? Anytime you want to use this as
Yeah,
a
just, you know, make sure that you know, if anybody out there is um maybe they haven't walked it, maybe they're a little bit older and they haven't been walking as much as they used to. Maybe they're grabbing the card at HEB. You know, it's not because you're old, or it's not because of that. It's because, you know, you need to get the blood flowing down there in your lower extremity. So check your feet for wounds. If they're not healing, you know, come see us, a PAD specialist. Or if you know, you feel like your feet hurt for no other reason, and definitely come check us out, and we're here to help the community out. So thank you.
well, thank you, guys. Folks, we'll leave you with this. You all stay safe, be safe, and God bless you all. Until next time, much peace.
God bless. Thank you. Bye-bye.
So when I was working on Selena, the series for Netflix, to play the role of Abraham Quintanilla, I put on a specific amount of weight, which I was fine doing, but also realizing it could be difficult to get that weight off. I got back into my physical regimen with James Leha, but I was still having trouble with just those last amounts. And that's when I got to meet Arturo from Laredo Medical Weight Loss Clinic. And just the products that he gave me kind of put me over the edge. I feel great about myself.